What you should know before getting a horizontal clitoral hood piercing. Coming up next on Consultations by a Piercer, episode number 48. For those that are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful and useful, but you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. I'm going to be discussing genital piercings today. If you find this offensive or you're not of an age that's appropriate to be hearing this information, I would suggest please find another video. We have plenty of other videos with different topics that don't involve anything that remotely comes near this. Also, if you're looking for something that's going to be sexually stimulating, you're going to be disappointed. This is solely for education purposes for those that may be considering getting this piercing, or maybe their partner or someone else involved in their sphere of influence. What we're talking about today is a horizontal clitoral hood piercing. This is the older of the two. I remember seeing this one long before I saw the other one, the vertical, but the vertical is a lot more popular. Horizontal is done at the top of the, towards the top of the vulva through the tissue that there's a flap of tissue that lays over the top of the clitoris. And at the top of that, there's a little bit of loose tissue. It's done horizontally through that area with a ring hanging down. We try to target it so the bottom of that ring hits the underside of the clitoris. Now, average healing time on this one's going to be anywhere from 6 to 8 weeks, but I suggest always treating them like especially if you're sexually active, as a healing piercing for a minimum of 3 months. And that's going to involve, first off, cleaning twice daily using a sterile saline solution. Personally, I like Neomed's Piercing Aftercare. It's very convenient, premix, sterile in the can, easy to use, doesn't really require any additional steps because it comes out in a fine mist. Now, you may not be able to find that in your part of the world for whatever reason. There are plenty of other options on the market. The main thing you want to look for is that it's in a pressurized can. It is a metal can in most cases. And it says on the outside of it sterile. And when you turn it over and look at the back of the ingredients, it says sodium chloride in some type of purified water. Nothing else. No additives, no preservatives, none of that stuff. If it's that is not what you need. Now, there's kind of two forms of delivery with these nozzles. There's the fine mist, which you spray directly onto the piercing, and then there's the kind that kind of comes out like a squirt gun. If you have the kind that kind of comes out like a squirt gun, I really suggest taking a sterile gauze sponge, or you could get away with using a folded up paper towel if you're careful, spraying that on there so that it's damp, and then lay it against the piercing and do a cold compress. You want to either way, you want to let it stay in contact for roughly about 5 minutes, and then pat dry if need be. That part you want to do twice daily throughout the entire healing period. Once a day in the shower, at the end of your shower, stick your pelvis out and let the water flow over the area for about 30 seconds. What we're doing with these two things is we're removing that hardened discharge from the jewelry. And the reason we want it off there, especially with a ring or circular jewelry, is as that jewelry moves, it can agitate and irritate the piercing. Plus, it does not feel very comfortable. So it's for comfort, and it's also to avoid problems. Now, cross-contamination prevention. Common sense stuff. Wash your hands before you handle it. No oral contact. No exchanging bodily fluids on or around the piercing for a minimum of 6 months. Now, that doesn't mean you can't have sex for 6 months. That just means your partner needs to use some type of latex barrier to avoid the exchange of bacteria. Now, keep in mind, we're not talking about STDs or STIs in this situation. We're talking about just plain old bacteria. We all have our own little cocktail, and having contact with the piercing, which is an open wound, could possibly lead to an infection. Keep your environment clean. Clothing, bedding, towels, anything that may come in contact with the piercing does need to be cleaned on a regular basis. Keep pets away from the area. Do not let them have access or sleep in your bed, especially under the covers. Do not swim. Do not submerge piercing in bodies of water you cannot control the quality of, which is everything but your own clean bathtub. You're going to see conflicting viewpoints on this, if you get this far into the healing process, not a problem. Yes, it reduces the risk, but it doesn't completely go away. You always want to think of it this way. A healing piercing is an open wound. Any body of water that's large enough for you to submerge your whole body in and move around is going to be packed and filled with microorganisms. Those get into that piercing, it's going to probably cause an infection. So don't swim. Now let's talk about trauma, clothing, and abuse. Avoid constrictive or clothing that might get caught on the jewelry. Usually simplistic is always best. This one really doesn't get caught as readily as other genital piercings have the possibility to do. But if you're not careful, it's always a possibility. Do not sleep directly on the piercing. Make sure you're sleeping on the other side of your back. I'm not quite sure how you would sleep on this piercing, but if I don't say that, somebody out there will find a way to do it, I'm sure. Do not spin, rotate, or move the jewelry. There's absolutely no reason to do this, and it's only going to increase the likelihood of infection. Also, don't play with the piercing excessively. Avoid contact with the piercing in general. It's always best to just kind of avoid the area and make sure that anything that comes in contact with the area isn't causing damage. If you feel pain, stop doing what you're doing. Risk. On this one, there's not a lot of risk. There's always rejection and migration with any genital piercing. If you remove the jewelry, there's a possibility if it isn't far enough along in the healing process, it could possibly close. But generally for that, these are pretty quick healers, and they're not very traumatic. Now let's talk about sex. Gentle at first. If it hurts to do something, you need to stop, switch positions, or try something else. At least rest between to give your body some time to kind of recover. Listen to your body. If it hurts to do something, slow down, try something else. Latex barrier for the minimum of 6 months. Like I mentioned earlier, this is about bacteria and not STDs. Water-based lubricants only. Do not use anything that's got warming gels in it or flavor or any of that other stuff. Just very basic water-based lubricant. Now, if you use any type of toys, you do want to clean these on a regular basis, and it's not a bad idea to put a fresh condom on them if to cover the toy, just to make it easier to clean and maintain, but also to just eliminate the possibility of there being a problem. Of course, don't ever share it, and if you do share it, you definitely want to use a condom every time. Now let's talk about anatomy, placement, and angle, and etc. This particular piercing, I always mention there's vulvas, there's either hills or there's valleys, and everybody's in between the two. This one works best if it is a hill, where there's more of that genitalia that's more visible and outside the body. Valleys, where it's more compacted inside, the jewelry can be twisted back and forth where there's not enough room for it to sit there comfortably. This is like I mentioned earlier, this is placed horizontally through the tissue at the top of the clitoral hood, with the jewelry hanging down and having contact with with what is exposed at the bottom of the hood of the clitoris. Jewelry. This one, catty bead rings or beaded rings. You could do circular barbells would be the other option. It just works best. I know it's kind of weird to hear that because there's just not a lot of jewelry that we suggest doing with this type of stuff, but this one works best that way. Pain in the piercing experience. Most people say on a scale of 1 to 10, this can run anywhere from a 2 to a 5. Breathing exercises are always helpful, where you take a deep breath in, hold it, and then exhale. And your piercer can guide you through this. If they don't mention it to them and have them do it. This is done with forceps usually. I guess you could do it freehand. You clamp the area. Well, first off, you disinfect the area, mark it, clamp the area, inject the hypodermic needle in and through, take the forceps off. The jewelry is placed against the back of the needle with rings. This is the way it's done. And then pressure is applied on the front side of the needle on the other side of the piercing, and then it's slowly inserted into the piercing, and the jewelry is closed, and you're done. There may be some slight bleeding off and on. It's not uncommon sometimes to have some aching or throbbing. Really, with genital piercing, it's kind of usually a very intense experience at first, and then it fades very rapidly. Now, it will be tender to the touch for a couple weeks. If you bump it, add too much pressure to it, catch it, twist it, etc., it's not going to feel good. And that's your body training you to keep things away from it. First thing is, and foremost, I always suggest talking to your partner. This is going to affect their life in a way. It's going to require them to use condoms or latex barriers, etc. So it's a good idea to get their feeling. Understand that it's always your body and your decision. But If you're in a committed relationship, communication is very important, and doing this despite your partner may create problems that you're unaware of, and it's a good idea to get their input in advance. Loose-fitting clothing is best. Kind of check your wardrobe, have some things available for you, especially the first couple of days where you just kind of sit around the house in sweatpants and just relax. It's going to be a little bit more comfortable. Always a good idea to have a piercing done a few days before you have some days off, just so you can sit around, relax, and not have to worry about it. You cannot swim. So if you're a swimmer, avid swimmer, or planning on other things that involve swimming, do this either before, heal it out, then do the swimming, or do it after you're done swimming. During the winter maybe. Last thing is, are you going on vacation or some type of trip? The problem with that is not only is a piercing kind of a hassle to deal with while you're on vacation, but the other issue is that you have no control over how clean that environment's going to be. You may be exposed to microorganisms and other pathogens that you've never had any exposure to in the past, thus have no immunity towards, so you're at a higher risk for infection. The other issue is most people want to swim when they're on vacation, and you're not going to be able to do that. So it's best to wait until afterwards or heal the thing way in advance of a vacation. One final thing, because it kind of comes up with genital piercings. If you and your partner have been away from each other for a long period of time, or you have a special event coming up, like an anniversary or, Valentine's Day or a birthday or something, and you're doing this to kind of excite your partner and as a surprise, I don't advise doing it because it's going to complicate you guys having a good time, so to speak. Really, it doesn't work well to get this done Valentine's Day or a couple days before. Just do it afterwards. If you know that you're going to have some period of time where that's just part of your future routine, then it's best to wait until afterwards. The other thing is I generally suggest you and your partner have kind of a fun day and enjoy each other. You're not going to want to do this for a few days afterwards, and you might as well get kind of a little bit of that out of your system and, connect with your partner. Well, if you have this piercing, why don't you leave a comment and let us know what your experiences were like so you can share them with other people, and it can help with their decision on whether or not it's the piercing for them. Till next time, here's hoping that your piercings heal with ease without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in the next video.